Childhood infections, childhood exanthems, infectious diseases characterized by rash, that is called childhood exanthems. Classification in order of historical importance. First disease, measles. Second, scarlet fever. Third, rubella. Fifth, erythema infectiosum. Sixth disease, Roseella infantum exanthema sublutum. First, we'll see what's happening with measles. It is caused due to single stranded RNA virus. Incubation period is 8 to 12 days. Mode of spread is respiratory droplets. Secondary attack rate is more than 90%, highly infectious and contagious. Infectivity period of isolation 4 days before to 5 days after onset of rash. Clinical features. Prodromal stage day 1 to 3. Fever intensity increases after rash appears. 3 C's: cough, coryza, conjunctivitis. Second, exanthem 2 to 3. Internal manifestation, Koplik spots, characteristic. And white spots surrounded by reddish hue, usually opposite to second molar, lower molar, rice grain of sand appearance. Exanthematous phase day 4 to 8 at external manifestation, maculopapular rash, site behind ear face, downward spread, trunk and extremities, leaves behind brownish pigmentation, increase fever intensity after rash appears. Measles rash. Complication: acute, most common otitis media, most severe pneumonia, increased mortality risk, most severe pneumonia due to virus, giant cell HT pneumonia, HEC-HT pneumonia due to superimposed bacterial infection, Staph aureus staph pneumonia. Chronic SSP, subacute sclerosing panencephalitis. Rare, 1 in 1 lakh cases. Latent complications 7 to 13 years after primary infection. Clinical features: myoclonic seizures, and we are reading about measles. If complications are chronic, it is called subacute sclerosing panencephalitis. It is very rare, 1 in 1 lakh cases. It was shown in an episode of House. Latent complications 7 to 13 years after primary infection. Clinical features: myoclonic seizures, cognitive impairment, history of recent deterioration in school performance, personality changes, diagnosis anti-G, anti-measles antibody present in CSF, fatal condition despite immunomodulatory treatment. Management: supportive treatment, adequate nutrition, antipyretic and IV fluids. Vitamin A supplementation decreases morbidity and mortality by 50%. 2 doses 24 hours apart. Dose: more than 1 year old, you give 1 lakh international unit. Less than 1 year old, you give 2 lakh international unit. Coming to scarlet fever. Etiology: scarlet fever is caused due to group A beta hemolytic streptococci. Toxin is pyrogenic exotoxin, erythogenic toxin. Age group 5 to 15 years. Clinical features: fever, sore throat, tender anterior cervical lymphadenopathy, strawberry tongue due to hypertrophy of papillae. Rash starts on second day of fever, spares palms and soles. In scarlet fever, you have fine maculopapular sandpaper rash on face, on trunk and extremities, and Pastia's line rash accentuation at skin creases. Post streptococcal complication, acute rheumatic fever, post streptococcal glomerulonephritis, post streptococcal reactive arthritis management investigation, throat swab culture. Treatment oral penicillin V for 10 days, more than amoxicillin for 10 days. So, preferred is oral penicillin V for 10 days. Coming to rubella rash, also known as German measles, 3-day measles. Similarity in clinical features. Etiology toga viridae, single stranded RNA virus. Incubation period 14 to 21 days. Mode of spread respiratory droplets. Infectivity period 5 days before to 6 days after onset of rash. Clinical features. First sign starts on day 1 of illness without prodromal stage. Maculopapular rash starts from behind the ear or face, spreads downward. No disquamation, discoloration after rash, disappears. Rubella rash. It starts from behind the ear and face and spreads downwards. It's a maculopapular rash. There's no discoloration. And first rash appears first sign in rubella. First sign is a rash. Starts on day 1 of illness. Exanthem. Forchimer's spots. Forchimer's spots are tiny rose lesions in oropharynx, lymphadenopathy, suboccipital, posterior auricular, and anterior cervical lymph nodes. Complication post infectious thrombocytopenia, 2 to 3 weeks after infection, self limiting condition. These are the complication 2 to 3 weeks after infection, self limiting condition. Second is arthritis, which is seen in older children. And third is progressive rubella panencephalitis, PRP, which is most severe. Features are similar to SSPE, which is due to measles complication. What are the complications of rubella? Post infectious thrombocytopenia in arthritis, progressive rubella panencephalitis. Erythema infectiosum. Etiology parvovirus B19, single stranded DNA virus. Incubation period between 4 to 28 days. Age group more than 5 years. Clinical features prodromal stage, fever for 1 to 2 days. Erythema infectiosum. Exanthematous face external manifestation. Stage 1 in erythema infectiosum, slapped cheek appearance, facial flushing, slapped cheek appearance. Diffuse macular erythema, spread of rash to trunk and extremities. Stage 3 center clearing of rash, lacy reticulated appearance. Associations. Arthralgia in older children, transient aplastic crisis, pre-existing hemolytic anemia, plus parvovirus B19 infection, presence with pancytopenia, infections in the mother during pregnancy. Management supportive management with good prognosis. Roseola infantum or Exanthema subvitum. Etiology human herpes virus HHV 6 more common than 7. Ecovirus 16. Age group 6 months to 3 years. Clinical features prodromal stage 1 to 4 days. Fever, cough, running nose. Exanthematous phase on day 4. Maculopapular rash starts in the trunk. Decreased fever intensity after rash appears. No residual pigmentation. Exanthem Nagayama spots. Erythematous macules in soft palate and uvula. Treatment supportive treatment and prognosis is good. So clinical features in Roseola infantum has prodromal stage, then exanthematous phase, and then exanthem. Hand, foot, mouth disease. Age group happens in preschool age, less than 5 years. Causative agent is Coxsackie A16 or Enterovirus 71. Mode of spread is direct contact, infected fomites like used towel. Clinical features fever, vesicles resolves after 4 to 5 days. Treatment supportive. Most common complication is temporary loss of nails 4 weeks after initial infection. Papulovesicular lesions on in palms and soles. Blisters around the oral cavity, first manifestation. That's why they say that wash your hands after meeting these patients or wear gloves. Varicella chickenpox. Characteristic causative agent Varicella zoster virus, double stranded DNA virus. Causative agent for varicella chickenpox is Varicella zoster virus, double stranded DNA virus. Incubation period 10 to 21 days. Mode of spread droplet spread. Infective period isolation period 24 to 48 hours before onset of rash, crusting of all lesions. Varicella rash. Secondary attack rate is 80% in varicella. Clinical features fever, rash, day 2 of fever, lasts for 3 to 5 days. It's a macule, then a papule, and then a vesicle. Classical rash, pruritic lesion. Starts in the trunk, spreads to other areas, leaves behind hyperpigmented macules, pleomorphic appearance, dewdrops on a rose petal appearance, fluid filled vesicles. Complications secondary bacterial infections of skin lesion, Staph aureus or Strep pyogenes. Neurological cerebellar ataxia, meningoencephalitis. Rise syndrome, aspirin usage in varicella. Causes hepatic encephalopathy when you use aspirin in varicella chickenpox infection. It causes Rise syndrome, hepatic encephalopathy. Diagnosis is primarily clinical, or you can send a swab. Lesion scraped and zinc smear, very poor sensitivity. Multinucleated giant cells. You can send serology anti-IgM antibody against varicella, anti-IgM antibody. Treatment antipyretics, paracetamol, antiviral acyclovir, 20 milligram per kg per dose into 4 times is 4 times per day acyclovir. 20 milligram per kg per dose 4 times a day. Starts within 48 hours. Avoid ibuprofen, increased risk of necrotizing fasciitis. Varicella vaccine prevention. Varicella vaccine. Live attenuated OCA strain. Dose 2 doses subcutaneous. First dose 15 to 18 months. And second dose 4 to 6 years. Live attenuated OKA strain. The brand used in North America is called Verivax or Verivax, and it's chickenpox uh, in vaccine. It is first given at 15 months, and then again at 4 years they give MMRV, that is with MMR plus V is varicella. If you are giving it in adults, then you need to give it in 2 doses, and it should be like at least 2 months apart from their pregnancy if they are planning to be pregnant, and it has to be 2 doses 1 month apart. If not administered previously, post exposure prophylaxis varicella vaccine. High risk contexts: immunocompromised children, pregnant women, neonate born to mother who was affected 5 days before to 2 days after delivery. In our next video, we'll see torch infections.